I'm Jason. I live in Madrid. I work from French and Spanish, as Carolina said, from medicine in the medical and pharmaceutical field. So I started off training as a doctor way back in the early 90s. And so that was a useful thing to have for me to specialize. So this one is just to give you an idea, an overview of blood tests. My goal is for you to feel more confident about translating a blood test. So I'll give you some tips and tricks, and hopefully you will find it useful. Please let me know if you do. If you didn't like something, or if you desperately wanted me to say something and I didn't, please just tell me specifically what that is, so I can fix it for next time. Okay, so moving swiftly on, this is basically my agenda for the next hour. I'll help you with some terminology. We'll look at the composition of blood in a cellular sense. We'll look at red blood cells. We will specifically look at hemoglobin, which is the oxygen transporting molecule. We'll talk a bit about clotting, which is the fancy word here is hemostasis. We'll talk about white blood cells. I've got a few poll questions, not too difficult, just to build on what I'm saying. I've got a few questions people have asked me during this session from other sessions when I've given this as a workshop or as a webinar, and then I'll give you some tips and tricks at the end, and I'll do my best to answer any questions.